So leptospirosis. We'll now discuss about leptospirosis. Leptospirosis is a bacterial zoonosis that is caused by various pathogenic species of Leptospira. There are more than 250 pathogenic serovars that have been identified. It occurs mainly in tropics, subtropical regions, in rainy seasons, and temperate zones. In temperate zones in late summer to every early rainfall. So epidemiology. Leptospirosis is endemic throughout the world countries like Thailand, Indonesia, India, Maldives, Sri Lanka, Bhutan, Bangladesh, Nepal, etc. It occurs mostly in tropical, subtropical, and temperate zones. This thing we have already discussed in previous slide. An estimated annual incidence of 0.1 to 1 per 1 lakh in temperate climates and 10 to 100 cases or more per 1 lakh in humid tropics has been described by WHO. The estimated case fatality rates in different parts of the world ranges from 5 to 30%. So the reservoirs are rodents, livestock like cattle, sheep, horses, goats and swine, canines, and wild animals too. Infected animals, their excretion of leptospires in urine intermittently or continuously, it occurs throughout their life. The mode of transmission is through direct contact, indirect contact, and aerosol inhalation of microscopic droplets. It occurs rarely. Aerosol inhalation occurs rarely. And clinical course includes two phases. The initial septicemic phase, characterized by symptoms of high fever, severe headache, malaise, muscle pain. It lasts for weeks. And secondary immune phase. In this phase, leptospires are rapidly cleared from the blood and CSF, occurs due to bodily immune response, and it lasts for a month or more. Clinical manifestations are of two types. Anecteric disease, that is septicemic stage, that consists of septicemic stage and immune anecteric stage. The septicemic stage, it occurs for 3 to 10 days and it involves fever, headache, nausea, vomiting and muscle aches. Leptospires can be removed or recovered from the, not removed, leptospires can be recovered from the patient's blood and CSF. The immune anecteric stage, it occurs from 4 to 30 days. It is self-limiting. Symptoms are non-specific. While icteric disease, it is called Wills disease. It has proportionally more fatality. It occurs in 5 to 10% of patients with leptospirosis. Jaundice, renal dysfunction, and hemorrhage are common symptoms. 15 to 40% of mortality occurs in case of Wills disease, and renal failure is the main cause of fatality in this case. So laboratory diagnosis is done by direct demonstration of the bacteria with a dark field microscopy using blood, CSF or urine sample. Motile organisms can be seen in the dark field microscopy using these samples. So demonstration using fluorescent labeled antiserum can also be very useful. Silver impregnation method shows black spirochetes against yellow-brown tissues. It is mostly used in pathology laboratory. So this is a picture showing black spirochete against yellow-brown tissues. Isolation and identification can be done from samples like bloods and CSF during first 10 days of illness. Can be isolated from urine for several weeks after initial infection. The specimens should be collected when patient is febrile and before antibiotic therapy is given. The culture media used is albumin polysorbate medium, that is EMJS medium. And leptospires, they are slow grower, so culture do not contribute in rapid diagnosis in early phase of disease. So microscopic agglutination test can be done, and in which IgG and IgM that are serially diluted, that are contained in serially diluted patient serum are agglutinated by using live culture of different serogroups of leptospires. Reading is done under direct field microscopy, and titers of more than 1:400 or demonstrated more than or equal to 4-fold rise in covalescent serum are indicative of infection. ELISA can be done to detect IgM, and it should be done within 3 to 5 days of onset of fever. Immunochromatographic assays, IgG, IgM against leptospira interrogens can be done. Molecular techniques include PCR targeting leptospiral gene.